All right, picture this. You're lying on the operating table, heart pounding. You're about to undergo a serious procedure. The surgeon, they're like a rock star in their field, ready to work their magic, right?
Right.
But they're not alone. There, by their side, is another crucial player, someone whose skills and fast thinking can really make all the difference in the world. And that, my friend, is the surgical assistant.
Absolutely.
And before we really get into it, I want to give a massive thanks to London Heartbeat's Zit Academy over in the UK. They've been amazing in supporting this deep dive. They're all about healthcare education. So if that's your thing,
Yeah.
seriously, go check out their website. I mean, they've got over 140 courses, so there's got to be something there for everyone. Don't forget, you can find them on like Facebook, Instagram, Spotify, YouTube. Give them a follow so you don't miss out on future episodes like this one. So today we're going deep, you know, really peeling back the layers to uncover the history, the evolving role of surgical assistants. And trust me, you might be surprised by what you don't know about these unsung heroes of the OR.
Yeah, you're absolutely right. And just to give you a little taste of how crucial surgical assistants are, the Bureau of Labor Statistics actually projects that the need for these roles it's gonna grow much faster than average in the years to come. And that's not just a number, it's a real sign of how essential they are to modern healthcare.
Okay, so to really get a grasp on where surgical assisting is today, we got to kind of rewind the clock a bit. Way back, like way back to the early days of surgery. Think ancient civilizations, right? Limited knowledge of the human body, crude tools, and definitely no surgical assistants as we know them.
Right. It is mind-boggling to think about, how surgery was even possible back then. It was often a solo act, surgeons working alone, maybe with untrained help, facing huge risks and just relying on really basic techniques.
It's hard to even imagine undergoing surgery without, anesthesia or a whole team supporting you. It makes you appreciate just how far we've come. But things really started changing in the 19th century, right?
Exactly. That's when you saw breakthroughs like anesthesia completely revolutionize the field. It allowed for much more complex procedures, but it meant there was a greater need for skilled assistance in the operating room, and that's when the role of the surgical assistant really started to take shape.
And that evolution, it kind of continued right into the 20th century, leading to like formal education programs for surgical assistants kind of popping up around the mid-century mark.
Yeah.
What made that shift so important?
Well, standardized training, it changed everything. It wasn't just about establishing a career path. It was about making sure there was a higher level of competence and ultimately about protecting patients, having clear education pathways, certification, all those standards. It elevated the profession, and it's directly linked to better patient safety, better surgical outcomes.
So fast forward to today, what exactly does a surgical assistant do in that crazy high pressure OR environment? It's got to be more than just passing instruments.
Oh, way more. Their responsibilities are way more extensive than most people realize. They're involved in literally every stage of the surgical process, from pre-op prep to post-op care. Even before the surgery starts, they're making sure the OR is sterile, prepping instruments, getting everything in place.
So they're kind of like the stage managers of the operating room, making sure the performance, so to speak, is smooth and safe.
Precisely. But it's much more than just setup. Once the surgery is underway, they're assisting the surgeon directly, providing retraction, which is crucial for, exposing the surgical site, but also minimizing trauma to the surrounding tissues.
I bet that takes some serious precision and a deep understanding of anatomy.
Oh, absolutely. They also handle suctioning to, keep the surgical field clear of fluids and debris, anticipating the surgeon's needs, seamlessly passing instruments, making sure everything just flows. They even help with suturing once the main part of the procedure's done.
Wow, talk about wearing many hats. It's like they need to be masters of multitasking, right? Combining technical skills with a deep understanding of surgical procedures.
You got it. And it's not just about the technical stuff either. Impeccable communication skills are key. Working in sync with the surgeon, the whole surgical team, all in a very high-stress environment.
So how do you even become a surgical assistant? What's the training like, the path to get there?
There are a few different routes. A lot of aspiring surgical assistants, they go for an associate's or a bachelor's degree in surgical assisting. And those programs really provide a solid foundation in surgical techniques, anatomy, physiology, and of course, patient care.
I'm guessing certification from Like a recognized organization is pretty important too, right?
It's essential, yeah. Certification validates their skills and knowledge, making sure they meet strict professional standards. Plus, it shows they're committed to excellence, which is huge when you're dealing with patient safety.
It's amazing to see how far this role has come from those early days of surgery.
Yeah.
But let's be real, it's not always easy. What are some of the challenges surgical assistants face in such a demanding field?
Well, it's definitely not your typical 9 to 5. Surgical assistants often work long and irregular hours, evenings, weekends, on-call shifts. The work itself it's physically and emotionally demanding. You're constantly dealing with these high-pressure situations.
Yeah, dealing with, life or death situations can't be easy. The burnout potential must be pretty high.
That's a valid concern, and it's something professionals in this field really need to be aware of. Maintaining a healthy work-life balance, seeking support when they need it, those are crucial for their long-term well-being.
Okay, so we've looked at the past, we've looked at the present of surgical assisting, but let's gaze into the future a bit. What's on the horizon for aspiring surgical assistants? What does the crystal ball tell us?
Well, the crystal ball is looking pretty bright. The demand for surgical assistance is projected to grow significantly in the next decade. Things like the aging population, the increasing complexity of surgical procedures, those are major driving forces, and it's creating a ton of opportunities.
That makes a lot of sense. As the population ages, the need for surgical interventions will likely go up, and as those procedures become more complex, the need
Yeah.
for skilled assistance, it becomes even more critical.
Exactly. And as technology keeps advancing, especially in the area of minimally invasive surgery, the role of the surgical assistant is going to keep evolving in some pretty exciting ways.
Speaking of technology, I'm really fascinated by the impact of robotics on surgery. How are surgical assistants adapting to this rapidly changing landscape?
Robotics is a total game changer in surgery, and surgical assistants are right there on the cutting edge. They're being trained to operate robotic systems, manage those interfaces, and even assist surgeons remotely.
Assisting surgeons remotely. That sounds like something out of a sci-fi movie.
I know, right? But it's becoming a reality. Imagine a surgical assistant in a completely separate control room, manipulating those robotic arms under the surgeon's guidance, potentially even across continents. It's mind-blowing.
That's incredible. It could totally revolutionize access to specialized surgical care for people in areas that don't have those resources readily available.
Exactly. And it's not just about remote assistance either. Surgical assistants are also playing a key role in developing and implementing these robotic surgical techniques, working closely with surgeons and engineers to refine those systems, develop new procedures, and really push the boundaries of what's possible in surgery.
So they're not just operators, they're innovators too. Sounds like a really exciting time to be involved in this field. And with all these advancements, I bet the demand for surgical assistance with robotic expertise is through the roof.
You bet. Hospitals, surgical centers, they're all actively searching for surgical assistants with specialized training in robotics. It's quickly becoming a must-have skill.
So for anyone thinking about a career in surgical assisting, developing those robotic skills could be a smart move. It's not just about the future, it's about the now.
Exactly. It's a valuable asset in today's job market, and it's a clear sign of where the field is headed.
But let's not get ahead of ourselves.
Yeah.
Like with any groundbreaking technology, there are going to be challenges and things to consider as robotic surgery becomes more common. What are some of the key issues we need to be thinking about?
That's a great point. As robotic surgery becomes more prevalent, it's crucial to address the practical and the societal implications. One concern that comes up a lot is the potential for job displacement. If robots can perform certain surgical tasks, will that mean fewer jobs for human surgical assistants?
It's a valid question. The fear of technology replacing human jobs is something we see across a lot of industries.
Absolutely. But it's important to remember that robotic surgery it's still in its early stages, and while it is advancing rapidly, it's unlikely that robots will completely replace human surgical assistants anytime soon.
So it's more likely to be a collaborative evolution rather than a complete takeover.
Exactly. The role of the surgical assistant is likely to shift to focus more on managing those robotic systems, troubleshooting any technical issues, and making sure the patient is safe.
Right. It's about leveraging the strengths of both humans and robots,
Mhm.
working together to get the the best possible outcome.
Precisely. And it's important to remember that robots, as advanced as they are, they still lack that human touch, that empathy, the critical thinking skills that are essential for truly holistic patient care.
There were just certain aspects of surgery that require that human intuition, that judgment, adaptability that robots just can't replicate yet. It's about finding that balance.
You nailed it. The
Yeah.
future of surgical assisting lies in this partnership, this collaboration between humans and robots, each leveraging their unique strengths. It's not about humans versus robots. It's humans and robots working together.
That's a future I can get behind. It's a testament to the ever-evolving nature of healthcare and the crucial role that surgical assistants play in shaping that evolution.
Well said. And speaking of evolution, let's shift gears a bit and talk about another trend that's shaping the future of surgical assisting specialization.
You mentioned this earlier, and I'm curious to dive a bit deeper into the different specialty areas that surgical assistants can pursue. What are some of the paths they can take?
As the field of surgery becomes more specialized, so does the role of the surgical assistant. Instead of being a generalist, a surgical assistant can choose to focus on a specific area of surgery, like orthopedics, cardiothoracic surgery, neurosurgery. The list goes on.
So they're essentially becoming experts within a specific surgical domain.
Exactly, and this specialization allows them to really develop a deep understanding of the procedures, the instruments, the patient needs, all within that particular specialty.
That makes sense. The human body is incredibly complex, and surgery is becoming increasingly intricate. So it stands to reason that specialized expertise would be really valuable.
Absolutely, and this specialization benefits both the surgical assistant and the patient.
How so? What are some of the benefits for each side?
Well, for the surgical assistant, specialization can lead to greater job satisfaction, higher salaries, and more opportunities for advancement. It's like any profession. The more specialized you become, the more valuable your skills and knowledge are.
Right. It opens doors to more specialized roles and responsibilities. And for the patient, what are the advantages of having a surgical assistant who's a specialist in their particular procedure?
For the patient, it's about confidence and peace of mind, knowing that the person assisting the surgeon has a really deep understanding of their specific needs, the potential challenges. That can be incredibly comforting. It can really alleviate anxiety and increase trust in the surgical team.
And I imagine specialized surgical assistants are also more adept at anticipating the surgeon's needs, which can lead to smoother, more efficient procedures.
You're exactly right. It's about seamless teamwork, precision, understanding. It's a win-win for everyone.
It's inspiring to see how surgical assisting is evolving to meet these growing demands of modern healthcare, becoming more specialized, more technologically advanced.
It's an exciting time to be a part of this dynamic and rewarding field.
Well, on that note of excitement and future possibilities, I think it's time we turn our attention to the professional organizations and advocacy groups that are really shaping the field of surgical assisting. What role do these organizations play in supporting and advancing the profession?
Professional organizations and advocacy groups are crucial for the growth and development of any profession, and surgical assisting is no exception. They provide a collective voice, resources, and a platform for collaboration and advancement.
So what are some of the key organizations that surgical assistants should be aware of? Where can they connect with their peers and learn more about the profession?
One of the most prominent organizations is the American Association of Surgical Assistants, or ADAS. They're a leading voice for surgical assistants in the United States, advocating for their professional interests, and they provide really valuable resources for education, networking, and career advancement.
That sounds like a great resource for anyone interested in this field. What kind of resources do they offer?
Their website is a goldmine of information. They have details on certification, continuing education opportunities, job postings, and even information about the latest developments in the field. It's a one-stop shop for surgical assistants.
Are there any other organizations that surgical assistants should know about?
Yes, there are several. Another important one is the National Surgical Assistant Association, or NSAA. They're also a strong advocate for surgical assistants, providing educational resources, professional development opportunities, and a platform for networking and collaboration.
So joining these organizations can help surgical assistants stay connected with their peers, learn about the latest advancements, and advocate for their professional interests. It's about building a community and a collective voice.
Exactly. And these organizations also play a key role in promoting the value of surgical assisting to the broader healthcare community. They raise awareness of the crucial role that surgical assistants play in ensuring patient safety and positive surgical outcomes.
It's about recognizing their contributions and advocating for their continued development and integration within the healthcare system.
Absolutely. And these organizations are at the forefront of that effort.
So how can surgical assistants get involved with these organizations and contribute to the advancement of their profession?
There are a few different ways to get involved. They can become members, attend conferences and workshops, volunteer their time, and participate in advocacy efforts. It's about active participation and contributing to the collective good of the profession.
It sounds like there are plenty of opportunities for surgical assistants to make a difference and shape the future of their profession.
Absolutely. The more active and engaged they are, the stronger their voice will be, and the more impact they can have on the future of surgical assisting.
Well, this conversation has been incredibly insightful. We've covered a lot of ground from the history of surgical assisting to the rise of robotics, the importance of specialization, and the role of advocacy in advancing the profession.
It's been a pleasure exploring this dynamic and evolving field with you.
And as we wrap up this first part of our deep dive, I want to leave our listeners with one final thought.
Hmm.
The future of surgical assisting is bright, filled with exciting possibilities and opportunities for growth and innovation.
I couldn't agree more. It's a profession that's constantly pushing the boundaries of what's possible in healthcare, and I'm excited to see what the future holds for these skilled and dedicated professionals.
Now, before we move on to our next segment, I want to take a moment to express our sincere gratitude to London Heartbeat Z Academy for their incredible support in making this episode possible. Their commitment to healthcare education is truly commendable, and we encourage our listeners to explore their website and social media channels to learn more about their amazing offerings. They have over 140 courses in all aspects of healthcare, so you're sure to find something that piques your interest.
Indeed. London Heartbeats the Academy is a valuable resource for anyone interested in pursuing a career in healthcare or simply expanding their knowledge of the field.
And remember, dear listeners, you can find London Heartbeat Z Academy on Facebook, Instagram, Spotify, and YouTube. Be sure to follow them to stay up to date on all their latest courses, events, and insights. You won't want to miss out on the incredible educational content they have to offer.
So be sure to check them out and tell them the deep dive sent you.